Welcome guys, my name is Patrice, The.Patrice.Denise. I'm over here living a healthy, sustainable life, one day at a time, one step at a time. I recently did a video on now what? When you're first diagnosed with diabetes, just some things to think about. And I want to dive a little bit deeper into that subject and just give out more information on diabetes that some people may not have known about or that some people may have just forgot about. So most of the time when you hear the word diabetes and diabetes management, we immediately think about food and how the food affects our blood sugars and what we should do to control diabetes by looking at what we're eating in our food intake, as well as exercise. We talk about exercise and things like that. So your providers are probably honing in on food, honing in on exercise, and just trying to make sure that you're aware of how those two can affect your blood sugars and help to manage your blood sugars if you're eating a proper diet and you're exercising and moving. But I wanted to dive a little bit deeper and just talk about real quickly some things that may affect your blood sugar that have nothing to do with food as well as nothing to do with exercise to a certain degree. So in the other video, I mentioned medications and how you should be aware of the medications that you're on. You'll be on different medications for blood sugar control. You may be on different medications for cholesterol, blood pressure medications, just to help with managing those diagnoses, because sometimes these things can be comorbidities or kind of affect each other. But did you know that your medications, some medications that you're on, can actually cause your blood sugars to increase? So for instance, beta blockers, these medications are used for blood pressure, to control your blood pressure. But some beta blockers, specifically atenolol, metoprolol, and propranolol, they can cause hyperglycemia, which is increased blood sugar. And that being because beta blockers reduce the insulin that the pancreas produces. That's just one of the mechanisms of action of beta blockers. So if you're on a beta blocker, definitely check with your provider to see if that specific one can cause hyperglycemia. Other types of medication that can have effect on your blood sugars: antidepressants, corticosteroids, and antibiotics. With the antibiotics, specifically quinolones, penicillins, cephalosporins, and macrolides. So if you're on these particular antibiotics, definitely again check with your provider to see if you should be on something different based on your blood sugars and how it is affecting your blood sugars. And while I'm talking about how it's affecting your blood sugars, are you monitoring your blood sugars? So remember, we talked about in the other video, definitely monitor your blood sugars by checking with a finger stick, and talk with your provider about how often you should be monitoring your blood sugars, okay? And then going back to corticosteroids as well as antibiotics, but if you're on corticosteroids for an extended period of time, you definitely want to check with your provider and talk about blood sugars and talk about what you should be doing with that, because corticosteroids can actually be a cause for someone to become diabetic, because they do increase your blood sugar significantly if you're on them for an extended period of time. So check with your provider. Definitely check with your provider when you are placed on a corticosteroid or any type of steroid for extended period of time. Now, ladies, I don't know if you've ever noticed, if you are checking your blood sugar, some ladies, their blood sugars seem to increase around the time at the beginning of their menstrual cycle. So when their menstrual cycle is about to come on, they see increases in their blood sugar. And this happened to me once when I was first diagnosed with diabetes, and I was monitoring it, and I was taking things back to my provider that I was noticing, and I told him my blood sugars are slightly higher around the beginning of my menstrual cycle, or leading up to the beginning of my menstrual cycle, and then they would taper back down. And I would just continue to monitor that. But because of our hormones and the increase and decrease and fluctuations of our hormones, that causes our blood sugars as well to fluctuate around our menstrual cycle. So just be aware of that. I don't think that they cause any significant increase, but they do cause a slight increase. So just be aware of that. If you're noticing, hey, I am taking insulin and I'm having to give myself more insulin around this time of the month, probably because, and you're eating the same thing, exercising the same way, and all of the above, all other factors seem to be sort of the same. It could be because it's the beginning or around the beginning of your menstrual cycle. And staying on the line of hormones, stress. Those stress hormones like adrenaline, cortisol, when they are increased, they can increase your blood sugar. They will increase your blood sugar. So You probably have heard that stress causes your blood sugar to rise. Well, it does because of those stress hormones and how the body works with them. So we have to find ways to alleviate stress in our lives. I know that is sometimes easier said than done, but we definitely need to find ways to reduce stress. And then that leads to another point, because you may see that your blood sugar may be higher in the evenings. And is it because of something that you're eating, or is it because you're more stressed in the evenings? So some people have CGMs where they can check their blood sugars at all times, 24/7, using this little monitor that's on the back of their arm, and they can see their fluctuations throughout the day. And if you notice that your blood sugar is always a little bit higher around the time that you have a lot going on in your day, it's probably because of that stress hormone, those stress hormones increasing and causing your blood sugar to increase. So that's a good thing to look out for when you are monitoring your blood sugars. Look at what could be causing you to, what is going on at that time. Is it something that I ate? Is it something that's happening? What is going on? And with stress and those hormones and the fluctuation, it just makes it harder for insulin to work properly. So that's why there's increases in your blood sugar, because there's not enough insulin being produced or released. Our oral health can have an effect on our blood sugars. So we need to make sure that we are taking proper care of our oral health, because in diabetes, when you have hyperglycemia, increased blood sugars, when they stay high, that can cause saliva to have more sugar in it, to have more glucose in it, which can lead to, if you just have sugar there sitting in your mouth, that can lead to infection, inflammation, and so forth, which is gingivitis. So gingivitis is an infection. We'll talk about that in a second, more illnesses. But gingivitis can increase your blood sugar because it's an infection. It's an infection of your gums. And so you definitely want to make sure that your oral health is kept intact. So definitely make sure you're following up with your dentist twice a year. If your insurance covers it, 3 times a year, or even more if your insurance covers it, or if you want to pay out of pocket, or however you want to pay it. But make sure you're getting your teeth clean, your gum clean, you're getting your oral health done. Illness. If you are sick, your blood sugar will be all over the place. That's just, it's going to be all over the place, because one thing might make your blood sugar increase, another thing might make your blood sugar decrease. But if you have an illness, which I was saying, gingivitis is an illness, it's an infection in your body, which can cause your body to think that it's under stress, which starts releasing those stress hormones, again, causing your blood sugar to spike, to go up, hyperglycemia. So illness, in that regard, if your body is under attack and releases those stress hormones, thinking like, what is going on? It can cause hyperglycemia. So illness can make your blood sugar go up. But in another instance, illness can make your blood sugar go down. Because if you're ill, sometimes when you're ill, you don't feel like eating. So then your blood sugar will go down. This is bringing in food. Now we have to bring in food to talk about this part. But if you're sick and you're not feeling well, that you're not eating, that will be causing your blood sugar to go down. You would experience hypoglycemia, low blood sugar. And then if you're not drinking, dehydration. Dehydration causes your blood sugar to increase. Dehydration causes what's happening is that because there's less fluid in your blood, which in turn makes the blood sugar more concentrated, which will make it seem like your blood sugar is higher than normal. So make sure you're well hydrated when you're not feeling well. If you're eating less because you don't feel good and you're on insulin, your doctor will or should talk to you about a sick regimen. So if you're not feeling well, what should you do with your insulin regimen? Should you decrease it? More than likely, yes, because you'll be taking in less food. So definitely talk with your provider about what you should do when you're sick and pertaining to your medications. And speaking of medications, going back to those antibiotics, those steroids, if you are sick and you're placed on any of those, what should you do? Definitely check with your provider and talk about how it affects your blood sugars. I've seen a person who was on steroids, or I know of a person who was on steroids, and like I said, it can actually cause them to have, be their A1C to go up to a point where now they have diabetes, and it was all because of being on steroids. So you definitely want to manage your blood sugar. Sometimes if you're on a long course of steroids or multiple courses of steroids, they are going to ask you to start checking your blood sugars more than you normally would to get an understanding of how it's affecting your blood sugar. So definitely talk to your provider, like I said, about that. And just some other things to think about that can affect your blood sugar. Lack of sleep can affect your blood sugar, leading back to stress, leading back to hormones. Your body temperature and the temperature outside can affect your blood sugar. Different factors go into that. If you're in extreme weather or extreme situations of being too cold or too hot, that can affect your blood sugar because it can affect how insulin is produced, released. And just be aware that some eye drops, some nose sprays, they have steroids in them. So again, with your medications, make sure to talk with your provider, ask questions. Write down your questions. Carry around a journal if you need to, a notebook, notepad, or your phone in the notes section. Write down your questions as they come up to take back to your provider. Or we have this technology nowadays where you can text a question to your provider, or you can look up a question too. Just make sure you're looking it up in a reputable source when you are trying to get information. But nose sprays, like I said, and eye drops do have steroids in them sometimes, not all the time, but sometimes. So check with your provider on that and how it affects your blood sugar. So monitor your blood sugars while you're using those medications and go from there. But I just wanted to pop in and give you some other things to think about when you're on this journey to control, to manage diabetes. Yes, we do stress, diet and exercise as the more primary way to control diabetes. But just think about these outliers that sometimes do affect how your blood sugars are and how they present. Hopefully this has helped someone just kind of trigger some things to think about as they are on their health journey. If you know some other things that you have noticed affects your blood sugar as you're monitoring and controlling your blood sugars, definitely put it in the comments below. If there's anything that you would like to present in the comments below that can help somebody else along the way, definitely put it down there. We appreciate your input. Thank you guys again for being part of this loving community where we're motivating each other, we're pushing each other, we're informing each other, we're educating each other, and we're giving each other tips and suggestions to help us along the way. I appreciate you guys. Until the next video, God bless.